Welcome to Ask the Expert North Texas here on News Radio 1080 KRLD. I'm David Rankin.
And I'm Kristen Diaz. We have been keeping our pulse on how our hospital's been running, how our nurses have been doing, and also our doctors as well. And this has really been stemming over the past couple of years with the pandemic, changing the way we live our lives. We've seen recently just a shortage of doctors, and some of you might be wondering, how is this going to affect my healthcare, especially in the long run? Why aren't more kids becoming doctors? Is there a solution maybe to the doctor drought? On today's Ask the Expert, we have Sharon Weinstein. She is a fellow with the American Academy of Nursing and a co-author of the award-winning book, Healing Healthcare: Evidence-Based Strategies for Mending Our Broken System. Sharon, is the system broken?
The system is not only broken, but it's beyond a Band-Aid. It's time for a surgical intervention.
What's involved in a surgical intervention in order to fix the system? How long is it going to take?
Often it takes a great deal of time, David. It's a matter of cutting out what is broken, what is perhaps diseased, and then rebuilding. Rebuilding, that's what it really is. So right now we have an aging population in the US. There's an increased demand for care because people are living longer, so therefore they have more things that can go wrong with them, right? And at the same time, physicians are approaching retirement age. So this mismatch, if you will, creates a supply and demand issue. It's a crisis that's been anticipated for years, but now it has reached its peak.
Yeah, there's definitely that has been seen in a lot of different industries where a lot of boomers are at the retirement age. I feel like there's something different though about doctors. I feel like there are some doctors that are like that one doctor you love and you hope they never retire. Maybe they kind of push that retirement age. They can go a little bit longer with their career, but I mean, who wants to work forever, right? So how do we maybe do better at recruitment or create programs for more students to maybe graduate quicker or get back into the workforce quicker? What is the solution?
Well, first of all, there is no Dr. Welby. I have to tell you that. Yes, everyone had that doctor on TV who was going to be the person who was the pillar of the community, who was always there, always responded, always ready to be there when you needed them. But it's not like that. First of all, younger people still choose medicine. They choose medicine as a career. But it's very interesting to me that 60% of medical students don't plan to provide patient care. They don't plan to be the doctor who provides patient care. They instead want to do something else. So they want to do health technology. They want to do policy. They want to do research. They want to do innovation. They want to be a consultant. They want to have a role where they can influence systems and drive change without the weight of what we refer to as bedside burnout.
I was just going to ask you, how much does burnout play in the number of doctors that want to get out of the profession? And then once they do that, where do they go?
Well, it's not just burnout because it's burnout for all professionals. And it doesn't come only from being at the bedside. A lot of it comes from the bureaucracy, from insurance companies that are driving them all nuts, that make it so much harder to be able to get paid for service when you know that you deserve the money and the compensation for it, but you just know that it's not going to work. So instead of traditional clinical paths, as I said, they're looking at other things. They're looking about stepping away from impact, about refining the impact. They want to improve lives, but they're just choosing a different way to get there. And it's a huge question because we're facing a drought. And truthfully, it's not just doctors. Longer wait times, shorter visits, delayed diagnoses. Fewer young people are choosing medicine in the first place. But as I indicated, the ones who are choosing it aren't staying in medicine. And then nurses are in crisis with burnout, mandatory overtime, emotional exhaustion, the whole concept of unsafe staffing ratios. This isn't sustainable.
With the research that you've done for your books, for example, and the network that you have and the people you've spoken to, is there a glimmer of hope somewhere?
There is a glimmer of hope because we do have more professionals who are trained now. So we have PAs, we have nurse practitioners, we have others. There are other people filling that gap. But at the same time, a lot of physicians are choosing concierge medicine. Yes, they don't mind staying in medicine, but they also don't mind if you pay them between $1,500 and in some cities, $10,000 a year just for the privilege of having access so that they will be there when you need them. So between that and the fact that a lot of our physicians are getting older and don't want to work anymore, is there a glimmer of hope? Yes, and I believe that it is those alternative providers who will fill that gap.
What happens to smaller towns, not only in Texas, but around the country? And doctors just aren't willing to practice in small towns.
No one is willing to practice in small towns. So yes, there's a bigger drought there because people want to be in a city that has the resources that they need for schools for their kids and for education and for more. They want to be where they can get what they need to live a good life. They don't want to live in rural communities. And so it creates a huge problem because the rural communities are where people are needed most. Many, many times over the past few years, they've done incentives through the federal government, allowing a doctor to go to a small town, stay there for a couple of years, build a practice, and then reward them financially for doing so. But nobody wants to do that anymore.
Wow, that is incredible. What are some of the numbers that you have from the data that you've collected as far as where this trend is going with this population boom, especially here in North Texas? Do you have anything that you could say about that, particularly for our area?
Well, I'm very familiar with your area. I was a Texan for 8 years, both in San Antonio and in the Denton area, and working in Dallas, and my husband worked in Gainesville. So towns that perhaps that people who are not from North Texas don't know about. But in general, the population age 65 and older is going to grow by 34.1% by 2036. The population age 75 and older is projected to grow by over 54%. That's according to the American Association of American Medical Colleges. As I said, seniors use more care. And as you said, the boomer population is going to place unprecedented strain on health systems in the coming decade. They'll be the first generation to truly face a severe, severe doctor shortfall. And now groups are saying that we could have a shortage of over 60,000 physicians in the US, close to 80,000 by 2035. At the same time, nurses are leaving in droves. They too are leaving. Numbers vary, but some people say that it costs about $75,000 to replace a nurse who leaves. But when you look at the real number in terms of replacing them, having somebody do the work while they're onboarding, making sure that they're up to speed, it could be closer to $200,000. We cannot afford to have people leave the system. And more than 3 in 10 doctors actively caring for patients are age 60 or older. 2 in 10 are 65 or older. And as they get near retirement, the system faces more demand, but we don't have doctors to meet that demand.
I think there's also something to do with the fact that, especially since the pandemic, people tend to trust doctors less. They go more online to Dr. Google to find out what their symptoms are, and then they're making a whole lot of mistakes. Or in some cases, they're taking medical advice from social media influencers on TikTok.
Well, they're doing that, number one. And number two, okay, they're not only depending on Dr. Google, but they're sometimes taking the diagnosis that Dr. Google gave, going to the physician and saying, this is what's wrong with me, and I need a script for this because Dr. Google said that I need it. But that's not quite right either. That's not going to solve the problem. That's not going to help the system. People go to technology first because they think it's a quick fix. Everybody is always looking for a quick fix. Mm-hmm. You can't get a quick fix for a systemic disease or something that is festering, that is long-term, that really needs perhaps an IV antibiotic or something else that is more intense, or maybe needs hospitalization or surgery. Dr. Google is not going to do that surgery. So I encourage the public to please, please, please make careful notes about what it is that is really bothering you. Make sure that you know your body, that you're aware of what's happening with your body. So if something doesn't seem right, you can give an active account to the doctor of, yes, this started 3 days ago, or gee, was it 6 months ago? There's a big difference. And as we get older, more systems fail, let's face it. So not only are we having a shortage of doctors in general, but what about specialists? Nobody wants to go into specialty medicine, pulmonology, cardiology, the big demands for older people. So no one wants to go into that. And then what's going to happen to the system? The benefit is not there from a physician standpoint in terms of payment. They're not being reimbursed what they should. government cuts to Medicare and more are horrific. And so, what is the incentive? Yes, I want to be a doctor. I want to be a nurse. I want to impact lives. I want to save people. I want to make them feel great. I want to provide compassionate care. But I also have a family and I need to put food on the table. And my kids want to go to college and somebody needs to support that.
Sharon Weinstein here on KRLD. Once again, she is a fellow at the American Academy of Nursing and the co-author of the award-winning book, Healing Healthcare, Evidence-Based Strategies for Mending Our Broken System. Thank you so much, Sharon, for your time. We appreciate it.